The WHO, World Health Organization, warns this week a new wave of COVID-19 might come back if countries drop their guard. Successfully holding the annual political meetings in China signals the significant progress the country has made in this arduous battle, when most other countries and regions are still facing growing numbers of daily coronavirus infection cases. Could the country seize the opportunity to improve its overall emergency warning and the reporting system? What will it take to improve international cooperation in warding off a possible coronavirus resurgence and future infectious diseases? I talked to Professor Zhang Shuyang from the Peking Union Medical College Hospital. The hospital itself has become a bastion of international cooperation. Professor Zhang, welcome to our program. I understand you and your team have been in Wuhan and you played an instrumental role. Tell me what your mission has taught you.
PUMC Hospital medical team took charge of the intensive care unit for COVID-19 patients. Our task was to receive most critical patients, those patients transferred from other hospitals and from other ICUs. Our first shift immediately began just 6 hours after our team arrived in Wuhan. At that time, the virus and the disease are still enemy in the shadow. There was too much on my mind. I need to make a good balance between saving the critical patients while protecting our team members. You know, majority of our team members are junior faculty. I see them as my family. I need and I must bring them back safely. So we are fighting for patients. At the same time, I was also fighting for them. In Wuhan, we are learning new things every day. We were touched by the further understanding towards COVID-19, while we raced against the virus and death. Weapons in our hands become stronger, and our patients were fighting along with us.
I know it takes a lot of work to save lives and also to make sure to get everybody in your team to get back home safe and sound. You know, talking about this, it seems that the Peking Union Hospital has been playing an instrumental role in communicating with the outside world about COVID-19 in Wuhan, and also be able to share China's experiences and track record with everybody else. You guys speak great English. You have a very international team. Tell me more about how you balance. I mean, on the one hand, working very hard to save lives in the ICU, that's very intense already. But at the same time, trying to make time every time when you're being asked about the advice for the international community. Professor Zhang.
As Dr. Edward 2 doses to cure sometimes and to relieve often, to comfort always. Mankind is a community with the shared future. In the context of the ravages of the COVID-19, there is no country can overcome easily without the global unity. The only way to success is to cooperate and to meet the challenges together. We see it as our responsibility to share our expertise with colleagues worldwide. So far, we have exchanged with international colleagues from more than 18 countries, and we will be there whenever our colleagues need us, no matter when and where.
Professor Zhang, on the ground, you and your colleagues have been trying to establish procedures and rules and the way of doing things, the best practices for your team and also beyond for almost all the medical teams on the ground. So under what circumstances do you think you can come up with these kinds of procedures, and how did they work so far?
We learned from SARS 17 years ago, but this time, before publicly informed with the risk of human-to-human transmission, standard procedure of coordinating and responding to the COVID-19 outbreak were established. We played a positive role in controlling the epidemic development. During the fight, the whole hospital united as one. We broke up boundaries in previous management system and established 9 emergency response teams. The multidisciplinary clinical team had set up our own rules and regulations.
Now, after coming back to Wuhan, China also has been quite successful so far to see the prevention and control of COVID-19. But from now on, many believe probably we have to live a life in which we have to deal with COVID-19 on a constant basis. So what does that mean for our healthcare system and our hospitals in terms of how you work and how you do things when we have a global pandemic that is hanging in the shadow every day?
The whole nation made great efforts and enormous sacrifice to fight against the pandemic. Unlike SARS, the global spread of COVID-19 may last for a longer time, and our nation has taken the next step for regular prevention and control of the disease. Hospitals are always the frontline battlefield against emerging viruses. Therefore, we need to be fully prepared, such as training, human resources, material support, working structure, information, and funding support. Now, our hospital is taking steps to strengthen the training of our staffs in specialty of infectious diseases and intensive care to enhance the capacity for diagnosis and prevention of emerging virus and to improve our current management systems.
Dr. Zhang, you yourself is a very well-respected cardiovascular doctor, and you've been doing a lot of research working with your international colleagues. Now, both as a frontline doctor and also as a top management member of a most well-known Chinese hospital, and also a scientist and researcher yourself, what do you make of the significance of international cooperation in a time when things are very difficult when it comes to politics? Is that still possible?
PMC Hospital was founded by the Rockefeller Foundation in 1921. Back at that time, it was an era of medical education reform in the US. PMC Hospital was implemented with the same training and the medical system with the Johns Hopkins School of Medicine. In the context of internalization, many pioneers of medicine in China was nurtured at PUMCH. As we say, our hospital in the cradle of Chinese modern medicine. Opportunities has been provided by PUMCH to participate in international collaborative programs or to receive training overseas. Taking my personal experience as an example, I had the postdoctoral training for 4 years at the Occidental Foundation Hospital in the United States. I was appointed as the vice chief of the Department of Cardiology after I came back to China. I had introduced and applied most advanced technologies and concepts that I learned back in the United States. PUMC hospital is the only hospital in the country that providing the precision anticoagulant therapy based on individual ACT indicator and contribute to the great reputation of standard and quality treatment. Almost all the departments have international connections with global partners. Last February, I remember clearly, on behalf of China, on the International Rare Disease Day, I introduced the progress that China has made in recent years in fields of the rare diseases, research and treatment, and exchanges with international colleagues. We learn from each other, and I believe this is the best way, and this is the only way.
Thank you very much, Professor Zhang. It's beautifully said, and I'm extremely touched by your own personal story about how a doctor, a real professional, comes into being through the help of many others. Really appreciate it.